Over the past few months, there's been a lot of attention in state government to two problems. And in part, I've described them a little bit as problems that have gotten more attention because they moved into the suburbs. And that has really helped people see that they're problems for all of Connecticut and not just the urban areas. One of those relates to alcohol, and one of those relates to drugs, prescription drugs. So now that I have mentioned the ability to say no, improve it, and take care of oneself, I thought that I would just mention a minute because Lakeisha did ask me to talk about the problems that I see for women in Connecticut and in the country. Binge drinking. There are a lot of heads nodding. So I feel like I'm just a downer, but anyway. So binge drinking is a problem in youth. 12-year-old, 13-year-old, 14-year-old, high school students, and adults. Women between the ages of 25 and 34, about 1 out of 4 of them binge drink. Binge drink. That's 4 drinks in a 2-hour time period. But about 1 out of 8 high school students do as well. So that's important to know because of all of the unhealthy effects of alcohol, but also the risk that drinking does in putting you at greater risk for accidents, a number of diseases, and for being the victim of sexual assault or other violence. So think about that. And then think about one of the biggest epidemics in our country right now is the epidemic of taking prescription pain medicines to get high. A lot of people think about alcohol, and it is a serious problem, but at the same time, there's an epidemic, an explosion of prescription drug use. That's, while more common in men, the rates of it are going up more quickly in women. Because of that, and because that use also occurs a lot in women of childbearing age, just in Connecticut, in the country, but including in Connecticut, the numbers of babies that are being born dependent on medications like OxyContin, codeine, have tripled in the past decade. And because they're prescriptions, people think, well, these are safe medicines. They don't really think of them as drugs. You know, they might say, oh, at least I'm not doing heroin or smoking crack. But sometimes people are smoking the prescription drugs now instead. So that's something that we at the Department of Public Health have been spending extra effort on, and we'll be spending more effort on over the coming year, really getting that word out. And the comment that I made about the increasing awareness across the state and increasing concern throughout everyone in the state relates to the realities that when people don't have access to those pills anymore, and they still are looking for a drug, they turn to heroin. So there are a number of towns in which the numbers of heroin overdoses are going up among people who can't find the OxyContin anymore, can't find some of those other pain relievers anymore, but they're addicted. Enough statistics. One of the things that makes me especially happy to be here is that I know that so much of what contributes to a woman, a person, but I'm talking about women today, ability to not fall to having as many unhealthy risk behaviors, whether or not they're the risk behaviors for heart disease, whether or not they're the things that make people put off going and getting their mammograms, whether or not it's not binge drinking, not taking pills to get high, is the importance of social support and social networks. And I'm standing here in the midst of an extremely supportive, growing social network. So being here isn't just nice on a Sunday afternoon on a long weekend. I propose to you that being here is good for your health. And if the next summit isn't until next October, I ask you, what are you going to do for the 364 days in between? To make sure that whatever you're doing there is also good for your health. So especially for the younger people in the room, one of the things that I know is that, and that not just I know, but that research shows, is that the more positive adults, having positive adults in your life really helps you make better behaviors. Lowers the chance that you're going to take the behaviors that are going to give you higher risk for gonorrhea and chlamydia and human papillomavirus. Should I keep going? Somebody's doing this. Lower the risk that you're going to have herpes, get HIV. Lower the risk that you're going to be a binge drinker. Lower the risk that you're going to be an abuser of prescription or illegal drugs. And if you don't want to hear anymore, look at somebody a little older than you and say, and for them to have positive people in their life, gives them somebody else that they're more likely to call up and say, let's take a walk together. I'm afraid to go get my mammogram. Will you come with me? I had an HIV test, but I'm afraid to go get the results. Because I know I've had a lot of patients who got tested but never went and got the result. Which is like not getting tested. Will you come with me? I don't have anybody else to talk to, but if I just had somebody to talk something through with. Those are all those other 364 days in between that we can be doing for one another. And for no matter how busy we are, and I joked, I was talking to my sister earlier today and I was saying, I'm going to talk about being supportive and being mentoring, and then I have to go run someplace to do some work because I always have something to do. And I had to stop and think, well, will that give me a chance to actually take the moment to do something else that I think is really important, and that's what I call random acts of mentoring. You have really formal, valuable mentoring relationships that you've established, but sometimes it's those momentary encounters where you've just taken the time to show about somebody that they matter in this world, that you listen to them, makes a difference. And here I am at 58, I'm the commissioner, great. I need those moments too. And the busier you get, the older you get, or the more the higher up in the ethers you get, the harder it might be to find those things. So I thought, since I had a really special experience a couple of weeks ago, said when it happened to me, I was going to share it with you today. Because I was the recipient of one of those random acts of mentoring that creates those moments when you say, now I know why I was there, and now I know no matter what else happened that day, everything was great because somebody took that moment. So who knows who Dr. Jocelyn Elders